Oh, we're live?
We are live. Hey, everybody.
Hello. Well, I know no one's here yet, Helen, so we're gonna...
Hey, all you people that are coming.
Hey.
Boob episode 9.
Oh my gosh, has it been 9 episodes?
Yeah.
Wow. We're like starting to, I don't know, make this a regular thing.
I know.
I'm excited about this. I think this is going to be the best boob tube ever because I think, we've got lighting and we've got something relatively simple behind us. I just think that lighting makes everything amazing.
I know. Low light is really nice. Sometimes.
I think bright light. I don't know.
Bright light is good. Yeah, bright light is good.
Oh, look, we've got some people
Hi,
on.
Elizabeth.
Hi, Elizabeth. So let's get started. I mean, we only have a few people on right now, but we can go ahead and get started and kind of get things going and rolling.
Mm-hmm.
All right, everybody. So hi, it's Helen and Tobi from the Boob Tube.
So glad to be here with everyone. So I'm coming to you from lovely Oregon, where it's about 40 degrees and raining off and on. And Tobi's going to make everyone jealous and tell us what her weather is like.
Yes, I'm coming from Florida, where it's at night and it's nice and muggy, and it feels nothing like Christmas time that's coming, but that's okay. That's okay. Yeah. We have some exciting things to talk about. This is our boob tube. This is what number? What number is it, Helen?
This is number 9. Niner. The big 9er.
9. We've been doing this for, oh my gosh, 9 months now. And it took us a little while. Hi, Corinne. How are you?
Hi, Corinne. So I just have to pop in here.
With our lighting.
Elizabeth Katura Anderson Sierra. So one of our lovely people that's on right now, we are going to be doing Facebook Live at her house on December 8th. She's
excited about that.
A super producing mom and pumps so much. I am so excited to go spend time with her and learn more about how she does it. And tune in.
I mean, listen, you inspire me.
Yes, exactly.
Wow. And we're going to be talking about, stuff with the boobs today. Definitely.
That's right. Hi, Salem. We're great today. How are you?
All right. Well, let's get started, Helen. So what are we talking about today on the 9th boob tube?
So today we're going to talk about breast pain. And this really is kind of a big topic because we're talking about breast pain prenatally, which is when you're pregnant. And we're going to also talk about breast pain postnatally, which is after you have your baby. And there's different reasons for each of those things. And there's different things that we can do to help relieve that pain, depending on where it's coming from.
Right. And I want to basically let everybody know while we're kind of starting is that we're going to be giving away a product today on our live. So definitely start commenting because we're going to be picking our winners. There's going to be 5 of them from the comments. That's the only way we can really do that. So definitely, even if you just comment hi, we're going to be picking our winners from the comments today. So we'll be talking a little bit later about what we're actually giving away. So stay tuned for more. But today we are, like you said, Helen, talking about breast pain. So let's talk about the pre-baby breast pain when we're pregnant. Let's talk about that.
Yeah, so for a lot of women, actually breast pain and tenderness is the first sign of pregnancy. It's not a hard and fast sign that you are actually pregnant. You'd have to, do your pregnancy test and find out for sure. But for a lot of women, that's like, suspect, let's see, my breasts are sore and they're kind of growing. I haven't missed my period yet, but I think I might be pregnant. So breast pain happens really early and is kind of one of those signs that a lot of us can't really miss, like our first kind of inkling that, we might have a little bun in the oven.
Now, what's causing our breasts to hurt and to grow a little bit? What's going on there? What's going on in here? I don't have see-through boobs, so tell me, Helen.
Come on,
there that's doing that.
Right. So what's interesting is they were all kind of born with this breast tissue, right? And the first time it really grows is during puberty, when our hormones kick in and we get these sex characteristics, which would be breast growth in girls. And this is something that happens simply because hormones act on this tissue. The tissue is receptive to the hormones. And what's good?
Wait a minute. So you're telling me that at 13, the same thing that happens when we're 13, 12, maybe 10, 11, where we're starting to develop breasts is the same thing that goes on in the beginning of pregnancy?
Well, kind of. Not exactly the same. Or else middle school would be really, really interesting, right?
Oh my God, can you imagine? I can't come out right now. I'm lactating.
I'm lactating.
I mean, who cares about pimples? Let's just talk about the fact that I've lactated when I'm 13. Okay, so lactating is not happening in that type of growth, which is thank God, at 13. And that's not the same thing happening in moms in the beginning stages of pregnancy, not lactating, just breast tissue growth.
Yeah, it's really cool, right? Because what we have is hormones that are acting on this tissue. Estrogen and progesterone are both telling our breasts to grow these milk-making cells and get ready to make milk to feed our baby. But another thing that estrogen and progesterone do is suppress milk creation, right? And so during pregnancy, we have these high levels of estrogen and progesterone where breast tissue is being created, but also it's also kind of keeping a damper on those cells actually getting to work. And what turns them on is having your baby. The end of your pregnancy is when estrogen and progesterone drop, and then the milk-making cells are like free to party on and get going and doing their job making milk.
Okay, so that's why that's a good thing to know that puberty, estrogen and progesterone are going and they don't really ever go away. So thank goodness we don't have the problems along with everything else as growing our breasts. Okay, so that's our beginning. But then we have postpartum. Really, postpartum is when we have most of our breast pain. And there's some common ones. Mm-hmm. So like, what's the first common one?
So the first common cause of breast pain after your baby is born is mastitis. So mastitis can be really uncomfortable, really painful, and it's actually an infection. It's actually when our milk stays in one place long enough, bacteria starts to grow, and then our body has to mount an immune response to that.
So now, I never had mastitis, but I know a lot of moms have. And I mean, have you, Helen? Have you ever had mastitis before?
I had mastitis with my second, and it was not only really uncomfortable, but I felt as a mom, I had my second baby. He was 3 days old. So of course, everybody wants to come meet the baby.
It's a family thing.
We had this full social schedule, and I have to say, I'm sorry. I just want to lay on the couch. You can't come over. And I felt really bad. Yeah, I felt really bad. I had a lot of guilt about that I was kind of letting people down. And looking back, I'm so glad that I let people down and took myself, because as moms, I think it's really hard for us to do that. It's hard for us to admit that we can't do something or that we just need time to ourselves. And so that was my body's way of telling me, take it easy.
Take a moment.
I'm so glad I listened to my body. I'm so glad I did it.
So when moms get mastitis, what are, so there's obviously redness, right? Pain.
Right.
Anything else?
Yeah. So redness, pain, there's going to be heat. The red spot is going to be hot. You're going to have fever and chills. You're going to feel like you're sick. You're going to just want to lay around. You're going to be very fatigued. And of course, a lot of times mastitis happens to moms in early postpartum. You're tired anyway, right? You're just pushing a human out of your body, and your hormones.
I don't think we get an award for that.
We don't. So there's definitely some signs of mastitis. And what we look for really is that red patch on the breast that's warm, and then the fever and chills.
Like warm to touch. It's going to be, it feels like, so, I mean, that's what moms have described. And it sounds to me like the worst thing that you could ever possibly have. So it's not going to be something where moms aren't going to know that there's something wrong. It's going to, your breast is going to scream at you and say, hey, pay attention to me. There's
pay attention.
Wrong. Do they have to go to the doctor and get any medicine? I mean, because I never had mastitis. Did you have to go to the doctor?
I did go to the doctor. I went to see my, actually my kid's pediatrician. I think it was at my 3-day postpartum visit, go in for the well baby check. I pulled up my shirt and I go, I think I have mastitis. And yeah.
Hi, I've never met you before. This is my first visit to you.
Here's my boob.
Mastitis.
Yeah. Right. Well,
I mean, I'm not laughing about that.
You know my boobs. That's the way it is. Yes, Nicole, that's a good point. You think that you have the flu and then you realize you have a clogged duct that gets infected. That's a really good point. So all you need really is for a physician, anyone, to take a look at that, determine that you have mastitis. You can get antibiotics. Some moms choose to go the more natural route and work out the clogged duct and use kind of warm, moist heat.
Okay.
Is something that you can do if you choose to not go the antibiotic route. That's fine too. But for me, that was the right choice.
How do you work? I mean, again, because I've never had mastitis. So how do you work out this clogged duct? I mean,
well,
can you do it?
Yeah.
Is my husband? Is your husband working out?
Yeah, your husband. He could, yeah. So what we want to do when we have mastitis or any clogged duct actually is what's called therapeutic breast massage. And therapeutic breast massage is good for just about everything. It keeps the milk flowing. Yeah. If you've ever watched Boob Tube before, I love breast compression. Breast compression is
all about touching the breast.
All about breast compression.
Let us know you're doing it. Touch the breast.
Because what we're doing is emptying the breast. And when you're able to empty the breast and you're able to get that clogged duct unclogged, then you're getting rid of all of that bacteria and you're getting things moving again. And so what you want to do is really, let me get my boob right up to the screen.
All right, I'm getting right up with you.
Together. Let's all do this together.
We've got a bunch of people that just got on. For what we're doing, we're talking about breast pain. This is the Boob Tube number 9, Helen and Tobi here. And we're talking about Helen had mastitis. And we're talking about how you can go to the doctor for that. But now we're going to talk about a natural way to unclog. There should be a wrap for that. Let's unclog the duct. Unclog the duct. So we're all going to unclog the duct, and Helen's going to show us how to do that. And we're all going to do it with her, so she's not individually touching her breast just for no reason.
Let's do it as a group.
All right. All right. What are we doing?
So what you want to do is start at the top of the breast, right near the rib cage, and just move the milk out towards the nipple. And
so it's like a push down and forward kind of.
Push down and towards the nipple. And there's really no wrong way to do this. You can use a fingertip. You can use the flat palm of your hand. Either one is fine. We just want to use gentle pressure and just enough to kind of get things moving. And keep in mind that therapeutic breast massage is a great way to prevent clogged ducts and also prevent mastitis. Because you're always keeping the milk moving.
So it's actually something not to wait until you get mastitis. You should probably be routine. Because I remember I would look down at my breast and look at my nipple, and I was trying to figure out where the holes were that this milk
There's so many holes.
There's no holes. I couldn't see any holes. I'm like, how do I know if there's a hole, if there's a duct that's clogged, and there's no holes for me to see that. So you really don't know that you have a clogged duct until you have a clogged duct and it gets infected, right? There's no preliminary, wow, I can see it clogged.
Well, you might have some firmness where the duct is clogged.
So it's already clogged and it's starting to get a little problem. So basically, mastitis is going to happen if it happens, but if you can try to prevent it by, breast massaging routinely. And then, just really paying attention to your breast, which it sounds like some other moms, when they were talking about it too, right away when you have it. So that's at least a good thing to do. But go to the doctor if you want to for antibiotics, or you can do heat therapy, and you could also, do the more breast massage, right?
Yes, it looks like one of our commenters, Ashley Purvis, talked about how she had mastitis and she used breast compression, hot compresses, and it worked for her. Yeah, so that's great. There's a lot of ways to do it.
Definitely, a lot of people came on just recently, watched us feel our boobs on the boob tube here. I want to let you guys know we are going to be giving away a Milky's product on today's show. And we're going to be doing it by picking just randomly picking 5 people that have commented. So please keep those comments coming, and we'll let you know in a little bit what that product is. Right now, we're talking about breast pain. We just got done talking about mastitis, and I want to add one in there that I had breast pain secondary to, for me, I called it a bad latch, but I think clinically it's called a shallow latch. And what that really means is, when you go to your lactation consultant, and a big thing they talk about is, having a nice wide mouth and having the baby completely cover the end of your breast, not, grabbing on to the tip of your nipple. Yeah. And I remember learning this in one of my classes, because I was really good. I went to a lot of breastfeeding classes because, I this was something I'd never done. I never had any family members that breastfed. So I wanted to learn on how to do that. And I remember them telling me, make sure you have the nice wide mouth, a good latch is good for, getting enough milk in and breastfeeding, but also, having a bad latch or a shallow latch can cause breast pain. And it's a very common cause of breast nipple pain for moms. And, I'll be honest, I was a little lazy at times. I kind of just would be resting, like you said, we just got done pushing this watermelon out, and I was tired. I don't know why I would be tired, can't imagine. I'm tired. And I was laying there, I just kind of let her just latch on, and however she latched on was fine. I was good with that. And then after a few days, that wasn't working because I started having a lot of breast pain. So I called my lactation consultant. She was like, are you doing the big mouth, Toby? And I said, maybe not. She called me out on it right away. And I was like, okay. So then it was funny. I used to say to my daughter, and I'd be like, big mouth, Ashlyn. And it's funny here. I'm not telling her, I'm telling myself, big mouth. But people would watch me. I'm breastfeeding. Big mouth. My 1-2-year-old, I'm telling her big mouth. And people, I know they would stop and look at me and go, what is this woman doing? She's crazy saying big mouth. But it was a way to remind myself to have a big open mouth latch. So that's another one that causes a lot of breast pain, is not having a good large latch.
Yeah. And I'm getting a little echo there. Another thing that can help with the shallow latch is actually breast compression can be helpful with that as well, because you're helping to force the milk from the breast. The baby's not having to work as hard, and your shallow latch seems to not be as much as a problem because your baby is not sucking so hard on your nipple to try to get the milk out, because you're helping the milk come out by using breast compression.
Okay, that makes sense. Yeah. And then now, did you ever use, I know I did, but I didn't like it. Did you ever use like the Lanolin or the breast creams when you had breast pain? Did you ever use those?
I did. I used the Lanolin because that's what I got in the hospital. I got a sample of it, and so that's what I used. But I only used that for my first, because after that I looked around to find something that was that was better. Because it was so sticky, it would stick onto my finger, and I'd have to try to brush it off onto my nipple so it would even be able to help me at all. So
I stained. So I used Lanolin too. And I swear to gosh, it would stain my clothes because it's that thick cream, and I would have all these clothes that would have these two oil stains that went through. So you would, eventually, I didn't like using that because I really didn't feel like it helped me very much. And I always would have to wash it off. So I'm using the soap to wash it off, and then I'm putting it back on, and so I'm drying my nipples out with the soap, and then it just was round. I just didn't think it really worked. I ended up using Soothies to help with my nipple pain. So that's something that moms can use. The one thing I brought that up because I wanted to talk about something that Milky's has, which is a lanolin free. This is our giveaway, so I'm really excited about this, guys. It's a lanolin free nipple balm. It's called Nipple Nurture Balm. This is what we're going to be giving away from Milky's today. And let me show you the inside. It's an olive oil based nipple balm, lanolin free. So we're good to know that. And it has natural anti-inflammatories. It's all organic. The one thing I thought that was really good about this was that it absorbed into the breast and it seemed to heal from the inside out instead of just something that just sat on the outside. Yeah. I think from the inside out is a better way of healing. And that's something that we're giving away. So in the comments, we're going to be picking 5 winners in the comments for our Milky's Nipple Nurture Balm that we're giving away, lanolin free, ladies. You'll love it.
Yeah, it's really nice and it feels great on the breast.
It really does.
It's great for nipple pain. It's great for nipple pain. And we know that anything in that area, we can call it breast pain. There's, I think the one that a lot of moms suffer with is engorgement. I'll see a show of hands who's been engorged. Yes.
Hands up. We got some hands up for everybody. Engorgement. Yeah. Okay, so let's talk about engorgement, Helen, because I think, engorgement is something that pretty much all breastfeeding moms have ran into. And a lot of times it's a simple fix. Well,
it can be. It really can be. There can be some different issues. Like if mom and baby are separated, for instance, if baby has to go to the nursery or there's some other health issue between mom and baby where they need to be separated, the milk can come in and the baby's not there to breastfeed. If mom has a lot of IV fluids during the labor process, we know there's a lot of medications that can drop a mom's blood pressure during labor. And so to combat that, your medical team a lot of times will kind of try to top off your tank with more IV fluids. That can lead to engorgement of the breast as well. And we know that if the milk is not being removed, so your baby has a shallow latch, or your baby is not coordinating the suck and swallow and the breathe kind of actions, then we can have inadequate milk removal and engorgement as well. And for a lot of moms, it resolves as soon as you get these things figured out. Your separation is over, you put your baby to breast and you're off to the races. Or, your IV fluid, you pee it out, your breasts go back to normal size, and then you put your baby to breast and you're off and you're doing great with breastfeeding. Engorgement.
My phone's ringing in the background because someone has to call right now. I don't know why they have to. I think another one though is that maybe we're not breastfeeding enough. Like, I know that when I originally was, going to classes and learning about stuff, everyone talked about, the baby would breastfeed every 2 to 3 hours. So being a new mom and someone who didn't have anyone around me that breastfed, I took that as like the gospel, and I can only, breastfeed every 2 to 3 hours, not any time before. And I learned later that that's not the right thing. You want to, your baby knows when they're hungry, and breastfed babies are going to eat sometimes every couple hours, sometimes every hour, sometimes every 3 hours. I mean, they're kind of all over the place. And if you are trying to be rigid on breastfeeding over a certain amount of time, then that's where you're going to run into possibly some engorgement also, because you're actually not breastfeeding enough times during the day. And that could go really with pumping. I think that runs into an even bigger problem with pumping, is because they tell you, you should only be pumping every 3 hours a day. So moms tend to try to be very rigid with that. Instead, you could be pumping more often to kind of relieve that engorgement.
Yeah. I think that's a great point, that we need to really listen to our bodies and not watch the clock.
Yeah.
Baby, don't watch the clock, because these are the cues don't have anything to do with time. They have to do with when your body is ready, when your baby's ready. So listen to your body, watch your baby for hunger cues, and you should be breastfeeding or emptying your breast at least 8 times in 24 hours. So this is what's going to help keep your milk supply strong and going. Remember our very first boob tube, we talked about how our bodies make milk. And the best thing, like the king of all milk supply, the king of milk supply problem solving is empty those breasts, because an empty breast is one that's getting the signal to make more milk. So we want to be...
So maybe not everyone has seen our first boob tube, because we know we keep getting new people every time. We love all you mamas, and we love that you are here, you're contributing, you're sharing your stories, along with that's what we're doing, is sharing our stories and info and knowledge. And we'd love for you guys, if you love what you hear on the show, definitely share it on your Facebook page. Get us out there so we can have more things to talk about. But if you haven't seen our first boob tube, we had a great thing where we were talking about how breasts actually make breast milk. And Helen, I want you to kind of, tell them just a little bit so we can talk about that. Green light means go, and that stop sign that means go. But just sum it up really quick. How does it work?
Well, it's really interesting. Our milk-making cells take nutrients from our blood, and they create milk from those nutrients from our blood. So the things that you eat every day, that's what your body uses to make your milk. And that's why it's important that you're drinking enough water and your diet is balanced. However, let me say this, your body will always make milk. Even if you don't have the best diet or you're not drinking enough water, your baby really comes first. It's really your body that's going to become depleted, because the priority is to make milk for your baby. And so what we have are these storage containers for our milk. And let's pretend this is a storage container and this is the wall of it. So within the wall of these storage containers are these stretch receptors. And if the stretch receptors get the message that they're stretching, they shut down milk making. And
this is engorgement. This is
engorgement right here. So it's your breast. Our stretch receptors are not stretched. They're relaxed. And so that signals your body, green light, make more milk. So always think about emptying your breasts, especially if you're thinking about milk supply and you're worried about milk supply. You really want to be sure that the first thing you do is empty those breasts frequently and thoroughly. And we had some questions about breast pumps, and I'd love to go back and answer those. Possibly after this show, we'll go back and answer comments.
Yes, and you know what? We love suggestions from you mamas. We have the ability to, do another boob tube where we talk about certain things. So please definitely, comment below on what type of suggestions of other boob tubes you would like. But I think
we love it.
We love it. I think pumping is a big thing because we can listen to our bodies, and we have our babies to help us with, releasing and definitely breastfeeding. Pumping, we don't tend to have that sometimes, especially for at work. We don't have our baby right there to say, hey, remember me, you need to pump, you need to feed me. And I think that's where engorgement happens a lot more. And that's where, like you said, we let those receptors get like this, and that eventually makes it stop producing milk, which makes sense why when we go back to work and we're pumping less, that we tend to not produce as much breast milk. So pump, breastfeed, and just, definitely keep that green light go, keep those receptors going. And we can definitely talk about some other, talk about pumping in another episode if you guys want to. So keep those comments coming in. And If you guys, obviously we're giving away a Milky's product today. Again, I'll show that to you guys. It's our Milky's Nurture Nipple Balm right there. It's a lanolin-free, olive oil base, all natural nipple balm that helps with nipple pain. So we're excited about that. But also we have a lot of Milky's products that deal with breastfeeding that help you to produce more breast milk, that collect, store. And we have a great thing with our Facebook Live. You can get a coupon code and get 10% off. So just go to mymilkies.com and you can put in FB Live and get 10% off. But, yeah, I just want to throw that in there so you guys need to do that because I want to make sure everyone gets as much discounts as possible on stuff.
Yeah, if you're having questions about your supply, be proactive, get your supplements, be sure that you're emptying your breast frequently. And if you want to add on some supplements that can help you increase your milk supply, like our Nursing Time Tea, our fenugreek, or our Nursing Blend, 10% off of all of those. And I see we have some questions here about how to make your body respond better to a pump. And I have a great video that I'm going to post in the comments. Please watch it. It is a wonderful way to increase your milk supply really quickly. And it's called Hands-On Pumping, and I'll put the link in the comments.
Guys, Helen loves to, touch her breast. And we're all, I think
in a clinical way, not in like.
I think secretly Helen just likes to touch her breast, but she figures out how to get it all in on this situation.
But only if we do it as a group. I like doing it as a group.
But yeah, definitely, hands-on pumping. It's something that a lot of people don't talk about where, you're actually helping to get more of the milk out and you're making your pumping less, and that's just something that it's a great video. It's a great talk. And, we just want to help you guys to, we're moms that have, suffered and, been there, done some things. And we just like to share our stories. And we love our moms on here that share their stories. Yeah. So if you love the Boob Tube, you love things that we talk about, please, keep sharing out there. And let's help moms just be successful in whatever breastfeeding journey they want. Because we're all about whatever journey you're wanting to do is the journey that we're wanting to help you to achieve and succeed. So
that's a really good point. And I want to go back and talk about some of our comments because we have some breast pain questions.
Let's do it.
So if you have breast pain, the first thing you need to do is figure out why you're having it. So it might be that your hormones are just working on your tissue and you're growing new tissue. If you are lactating, you may have a clogged duct, you may have mastitis. If you've ruled out all of these things that need attention and you're just really managing your pain, there's a couple of things that you can do. One of them is to take Tylenol or ibuprofen if you don't have an allergy. Follow the directions on the bottle, of course, for your correct dosage. The next thing that you want to do is use a cold compress. You talked about using a product called Soothies, which is a gel-filled pad. But you can also use, there's other things that you can use that, like frozen peas wrapped in a washcloth. Another thing that you can use. So remember that anything that's cold and kind of can take the shape of your boob is a great kind of do-it-yourself compress. Bag of frozen peas wrapped in a washcloth. Bag of frozen.
I want to see pictures of moms with frozen corn, face bandaged around, showing us that you've got boob pain because you know what? That's a badge of, I want to say it's a badge of honor, but all moms who have breastfed and pumped all are having those, breast pain. And I think we all have worn, the bags of peas corn and to cool these boob babies down, I
know. Whose UPS guy has seen them topless like 1 week postpartum because you couldn't put on a bra, right? Is it just
okay? That's not me. I think you're alone in that, Helen. I don't think anyone else is with you on that. If you're here with Helen, be there for it.
Okay. All right. Well, another thing that you can do to help with your engorgement and breast pain in the postpartum days is actually to use a cabbage leaves. Some moms really swear by this. There's not a lot of evidence that this is or we don't really know how it works. But what you do is you take your cabbage leaves and kind of peel them off. You put them in the fridge to let them get really cool. And then you take a rolling pin and break up all the fibrous parts of the cabbage leaf. And then you put it into your bra or on your breast until it cools down. So a lot of moms swear by the cabbage leaf remedy. So that's
I like that. I love Chelsea, who was saying that her husband is a UPS driver. He's
not my UPS driver.
I hope not. That would be a lot of extra YouTube mom sharing there.
Oh my gosh. Well, yes, frozen peas are also good for vasectomy care. It is true. They are tender areas of the body. Yeah. So that's a really.
I think we've done really a great boob tube. Love all that you guys were here. Again, remember, definitely we've got other boob tubes that you could go back and watch. And we love sharing stories. We've got another boob tube coming next month, so look for that. We will be announcing, make sure you like and follow us on our Facebook page so that you can be notified when we're doing another boob tube. But it's all about, talking and sharing our stories and hopefully giving some advice and helping moms, because that's really what we're all about in our boob tube, all about boobs, breastfeeding journeys pumping journeys that we're doing. So definitely get excited. We're going to be following up and doing a lot of, responding to everybody on the comments. So I'm excited for those who are going to be the winners. And we will see you guys next month.
Okay. Thanks so much for joining us.
Thanks, guys.